Good afternoon and welcome back to our last session. I can't even believe we're already here, but we are. And we're very excited to hear about the findings from the Keep It Maine pandemic communication, Rewards, Inspire, Evolves. At the end of this presentation, but in the same session, we'll be doing our closing remarks. And for those of you that have been participating in our challenge, you'll get to hear who our winners are. And for those of you that attended the poster session, you'll also find out who our t-shirt winners are. So please stay with us after this session. My name is Becca Bolas and I'll be moderating. And before we dive in, I just have a couple of reminders for you. The first is that we are offering conference captioning services. Within the session, you're automatically provided with the captioning, which is underneath the stream. If you don't need the service, you can just push the pause stop button and that will stop the stream. And the second reminder is to please complete the session evaluation. It's just 4 short questions and your feedback is helpful to us and to our presenters, and it's required if you're seeking continuing education credits. So with that, I will introduce our speakers. We have Sarah Price and Hannah Richards from Ethos Marketing, and I will turn it over to you.
Hello, everybody. Good afternoon. As Becca mentioned, the title of our presentation is Keep It Maine. And I'm Sarah and my colleague is Hannah. We work for Ethos. Ethos is a full service marketing and communications agency in Westbrook, Maine. We've been around for about 20 years. We're very proud to say that we are 100% employee owned. And we do a lot of work in the health, public health, and behavior change space. We love this work and we're really excited to talk to you about it today. Just a quick disclosure, Maine Department of Health and Human Services provided the funding to Ethos to develop and run the Keep It Maine campaign. Hannah and I, as presenters, have nothing to disclose with regard to commercial relationships. We have 4 learning objectives for our discussion with you today. Number 1, to outline the steps to take to build a strategic communications campaign that ultimately changes behavior during a pandemic. Number 2, to show you how an overarching campaign concept can be helpful when you're doing this work and how it can be adapted to meet the changing landscape of a pandemic and evolving public health guidelines. Number 3, to explain how we actually built the campaign and some of the practical aspects of building a campaign during a public health emergency. And number 4, how did we go about creating the messaging to inspire people to act while at the same time promoting good community public health? So what was the problem we were trying to solve? In May 2020, Maine DHHS asked Ethos for help with the following assignment: to develop an outreach campaign that would effectively address the ongoing public health needs for 3 behaviors: mask wearing, physical distancing, and hand hygiene. It's hard sitting here today to remember where we were in May of 2020, but just to paint the picture for you, this was really early days of the pandemic when we started this work. It was about 6 weeks into the pandemic. There was a tremendous amount of fear and uncertainty and misinformation or conflicting information. The assignment, as it was given to us, was to target an audience of adults, all ages, all races, and all socioeconomic levels, living statewide, including Mainers who have a low literacy level and or are non-English speakers. That may make you laugh or scratch your head, like, wait a minute, isn't that everybody? Like, who does that leave out in the state? And I think that was our reaction as well. It's a situation we often find ourselves in. In an ideal world, you would reach everybody if you had unlimited budget and time. And of course, that's what we all want to do. But from a practical standpoint, we always start with, okay, how do we understand more about our target audience? How do we group them based on similarity and refine who we're targeting into those that are most movable in terms of behavior change? So we did that work. We always like to start with primary research. In this case, it was such an emergency situation. People were dying. There was just a tremendous pressure to get going as quickly as possible. And so we had to rely on secondary research from the department and from other states. And that secondary research informed our insights about the target audience, and I'll share the most relevant. Number one, there were people in the target audience who were on the fence and the most movable. So we tend to think about it in terms of three groups. On one end of the spectrum, you have the tell me group, who is like, just tell me the key behaviors that are most important to keep me and my community safe, and I'll do them. And on the other end of the spectrum, you have the make me group, which is, I have a lot of concerns about this. I don't want to be told what to do, and I'm not going to practice these behaviors unless there's some serious negative consequences. But we learned that there was a lot of people in Maine that were in that movable middle, as we refer to them. They had questions, but they were willing to consider what these behaviors. Number two, we learned that people in Maine were becoming fatigued with the behaviors, especially as the pandemic continued. Again, it's hard to think back, but especially in the early days, there was no sense of how long this would last, and that added to the fatigue. And the last insight was that there was a distinct audience, subset audience that had a special need, and that was business owners. The pandemic was difficult for everybody, but business owners faced an additional challenge. Not only were they trying to keep themselves and their families safe, but they were trying to keep their businesses afloat. And they were asking for a very specific set of resources, and that was easy to access materials that they could put up in their business to get people to comply with the needed behaviors, to keep their business open, but to do it in a way that wouldn't alienate their customers. So they told us they needed materials that were positive and inspiring, but directive, like told people what they needed to do. Essentially, they wanted materials that didn't look like they were coming from, a government campaign. So we always start with the research phase, and that research and the insights about the target audience inform our strategy. And at Ethos, we really believe strongly that strategy must inform creative and not the other way around. The strategy tells you, how am I going to move this audience, and what choices am I going to have to make as I do the work? And so I'll share three things about the strategy for the Keep It Maine campaign. Number one, we determined that it would be important to tap into a deep identity and connection to Maine that many people in that movable middle had in common, that could be motivating, and it could get people to practice key public health behaviors because of that shared identity. Number two, we had early success in Maine in those first 6 weeks of the pandemic, and that success could be a cause for celebration that could motivate people, keep them strong, keep them committed to the behaviors, and it could help to combat the fatigue as that grew. And lastly, we had learned about our target audience that there was a common concern about the economy. People were really worried about their livelihood, what the pandemic was going to mean for Maine's economy. And so the third part of the strategy was to make a direct connection between good public health and the economy, how practicing these behaviors could help the economy get back on track.
So we used that strategy to inform the creative concept that we came up with for this campaign. Keep It Maine was the theme of the campaign, and we arrived there thinking about some of those strategies that Sarah just mentioned. So thinking about this feeling that Mainers tend to have, this sort of independence and ingenuity and sort of like survivalist almost. We have harsh weather, harsh winters, and we have this feeling that as a state, we're tough and we can get through those things. And so we really wanted to play off of that and create a campaign that motivated people instead of going negative or going towards fear. It was really rooted in uniting people with this sense of, we've got this, we're tough, look at the success we've already had, just keep going, do things the way we know how to do them, keep it Maine. So we executed that concept through a couple of different tactics. The first one was a landing page, and this was really the central hub of the campaign. So while we had digital ads, social media ads, broadcast, radio, etc., all of those led back to one central hub where all of that information was housed. It was super important to us that the URL for this landing page was easy to remember. So keepitmaine.org is something that's easy to remember, easy to spell, even for people who English may not be their first language. And then it was also a really sort of clean, simple, lots of white space. We wanted the page to feel positive and inspiring. We also really wanted to differentiate it from looking like a traditional government website, and we wanted it to feel more like a grassroots community campaign. And this is because, as Sarah mentioned, there was a major insight among the target audience that people were having a lot of distrust in the government at that time. And so we really wanted to separate the campaign and make it feel more like a community-based campaign. The other thing that was really important, again, with the non-English speakers or people with lower literacy levels, we needed it to be accessible to those people as well. So we used really minimal copy. We made sure that all of the language used on the page was readable for low literacy levels. And we used icons throughout the whole campaign so that even if you couldn't read English at all, you could get a sense of what we were asking you to do just from the visuals. So the next thing that we did, when we think about campaigns, especially behavior change campaigns, there's a couple of components. So the first component is you need to tell people or give them access to the information that they need. What behavior do you want them to do? But then you need to actually motivate them and give them a reason why they should do that behavior. Just telling someone to do something isn't enough. You have to dig a little bit deeper at that emotional aspect. And so part of the campaign was a broadcast video spot, which went on broadcast television and also digital and OTT. And this part of the campaign was really targeted at sort of uniting people and making them feel emotionally why it was important to do these behaviors. And so we'll play this video for you now.
I keep it Maine for my daughter, Fiona.
For my brother. He's 2.
I keep it Maine for my mom.
For the people in my neighborhood. It's a great place to live.
I keep it Maine to keep my customers safe.
I keep it Maine to help the healthcare system.
The healthcare workers,
I keep it Maine because it's the right thing to do.
Coronavirus numbers in Maine have stayed relatively low because of you. So keep groups small.
Keep 6 feet apart.
So in addition to that video, we also knew that not everyone was going to be moved or motivated by the same things. And as we mentioned earlier, there was a lot of sort of fear and resistance to being told what to do by the government. So another tactic that we used was...
I keep it Maine for my daughter, Fiona.
For my brother.
That's all right. Another tactic that we used was influencers. And so these were actually Instagram story ads that we created. But what the idea here was that if they weren't willing to listen to us or to keep it Maine, maybe they would listen to other people that they trust, people like Patrick Dempsey or Stephen King. Not pictured here, we also worked with Taco Fall, who is a basketball player. And so we tried to work with influencers who might hit different segments of that audience, different age groups, different geographic areas. And we had those influencers create videos asking people to follow those same behaviors, but in their own words. And then we cut them into Instagram story videos and ran them on that platform. So again, just thinking about different ways to reach people and different influencers that might resonate with those various audiences. And then the last tactic that we did, this is very straightforward and informational. These were digital ads and posters, the posters that we gave to the business owners. And these were, again, very visual, very minimal copy. And while the video that you saw earlier really spoke to the emotional piece of the campaign, this was directed at more of the informational piece, really making sure people had the information that they needed to follow those behaviors. So one other thing I just wanted to mention is while we were doing all of this creative work, of course, we were in the early days of the pandemic. So our agency was all working from home. We were in separate spaces. And as you might remember, things were moving and changing incredibly fast during this time. So a couple of things that we did to enable us to get this work done during a public health emergency. The first one was daily monitoring of all kinds of media. So news, traditional media, social media. It was really important that we not only had the information that DHHS wanted us to share, but that we also were looking at the information that people were getting from other sources. We needed to understand what our audience was hearing, even if it wasn't from us, so that we could combat misinformation or understand where they were coming from. And then we shared a lot of this information in daily huddles or stand-up meetings that we had over Zoom with our team. And so these were just 15 or 30-minute meetings that we would have every morning to regroup. And we focused on 3 things in those meetings. We would come to every meeting and ask, what work have you done? What's been completed? What are you working on now? And what do you need to be able to move forward with this work? And so structuring those meetings helped us really all come together and move the work forward quickly without getting off track or having, things were changing. We all needed to make sure we were on the same page every day. Another thing that was impacted by the pandemic is one thing that was really important to this campaign is that it felt like it was truly a Maine campaign. We didn't want this to feel like a national campaign that we adapted for the state of Maine, because the whole campaign was about Maine being unique and being a different type of place. And so it was super, super important that the images and video in the campaign reflected actual Mainers and felt authentic. That said, we had only a couple of days to get some of these assets live. So we had to rely on stock images in the beginning, but we really, really carefully curated those images to make sure that they felt like they could be actual Mainers. And then as soon as possible, we organized a COVID-safe outdoor photo and video shoot where we were able to capture photos of actual Mainers. And then we swapped out all of the assets in the campaign to feature the more authentic photos. As I mentioned before, when things are changing so quickly, it's so important that you are concise and clear in the information you're delivering. So we were always conscious to reduce how much we were trying to say. When you put 5 or more messages in any kind of tactic, people only take away 1 or 2 things. And we didn't want to risk that the 1 or 2 things they took away were the wrong things. So we really tried to reduce the number of messages that we were including in each piece that we were putting out there to make sure that what they took away was what we wanted them to take away. And then lastly, as I mentioned before, influencers were a really important piece of this campaign, and not just the influencers that we created Instagram story ads for. Dr. Shaw was another influencer in this campaign, and business owners were influencers as well. A lot of people were more willing to listen to their friends and neighbors and local business owners saying, hey, please wear a mask because it will help keep my business open. They were more receptive to that than they were to the government saying, hey, we need you to do this for public health. So we really thought about all of the different influencers and tried to give them the materials that they needed to share the public health messages we were trying to put out there.
How did the campaign evolve as we went? Well, as the campaign progressed, it became clear from the numbers that the cases were higher and the adoption of the key behaviors was lower in District 2. And so we changed and we focused our messages and our media dollars more on District 2 because of that. We needed to add a 4th behavior as we moved into the new season of cold weather. So if you think back to like November of 2020, there were some high profile cases and outbreaks that were tied to indoor social gatherings in Maine. And so it became clear to the department that we needed to add a 4th behavior to the campaign, and that was incorporated, the same look, icons, etc. And the science was evolving. Again, if you think back to May, there was a lot we were learning, the experts were learning, and we had to evolve the messaging to make sure it followed the science and we were providing people with accurate and up-to-date information. Hannah mentioned that in our experience, simple, clear messages are so important. Another thing that we have learned is that a multi-platform campaign gives you the best results. If it's a noisy, fragmented world, and we all consume our media and our information in a lot of different places. And media planning today needs to reflect that. So this campaign had TV, radio, and digital, but it had a mix of broadcast and streaming for both TV and radio. If you think about radio as an example, in the beginning of the pandemic, broadcast radio audiences were down. People were not in their car as much. And people were consuming more radio on streaming apps, services like Spotify. So we made sure the campaign was multi-platform. Our digital campaign was strong with Google Display, Facebook, and Instagram story ads. And here's just a few of the top line results for the campaign. We had over 35,000 unique website visitors to the keepitmaine.org page. Broadcast and streaming TV yielded over 2.7 million impressions. Broadcast radio, over 1.7 million impressions. And the digital and social advertising campaign drove almost 20 million impressions and over 46,000 clicks. So we were pleased with those results. We learned a lot. We felt lucky to be able to do this work, and we learned a lot while we were doing it. Number one, it reaffirmed our belief that good branding is essential to good public health and to behavior change. As I said a minute ago, it's a noisy, crowded world. And if you create assets that are emotionally compelling, that make a connection to people, that's what gets them to stop and pay attention. And that's job number one before you can give them information and convince them to change their behavior. So that was really sort of a reaffirming for us. The core messages being simple so that people can understand and remember them was another lesson learned.
We also learned how important it was to be monitoring really frequently all of the social media channels that we were running these spots on. There was a lot of misinformation at that time and still today, and we wanted to make sure that we kept the Keep It Maine pages free of misinformation. So while we didn't want to censor people and we allowed differing opinions on the page, we were constantly scrolling through comments to make sure that we were getting rid of anything that was direct misinformation or any kind of hateful or aggressive behaviors, so that we could keep those pages a safe place for people to get information. We also learned, and this is something that we've learned in much of our behavior change work, how important it is to level with people and validate their concerns. As I mentioned before, you can't change people's behavior by simply telling them what to do. And so while it was tempting to say, come on, we have all the research, just do what we're saying, you really had to validate. People were feeling like they were getting conflicting information. They were nervous about their own health and their families. And we really had to level with them and understand where they were coming from in order to give them information and deliver it in a way that they could accept it and act on it. And then lastly, we had to be adaptable, right? Pandemic, the only constant was change and still is during this pandemic. And so we made sure that all of the tactics that we were using and the work that we were creating could be easily updated and adapted as we went. And again, as I mentioned, we met daily to make sure that we were evolving as quickly as the pandemic was evolving.
Thank you very much for your attention and time, and we look forward to any questions.
That was great. Thank you both so much. We do have some questions that have been coming in, and I'll just say to folks that are joining us to keep them coming, just use the Q&A feature. So the first question that's come in is a multi-platform or multi-pronged approach, seems ideal. It makes a lot of sense to do that. But for organizations that may not have that budget or ability to do that, where do you suggest they focus their efforts?
So I would suggest that you start by making choices around your audience segmentation. So as Sarah talked about before, we had this huge audience of everyone in the state. And even with a campaign that was well funded, we had to make choices. Again, we mentioned we ended up focusing on District 2. So as you think about your audience and you choose that priority audience, I would say think about where that audience is most likely to consume media. So if maybe you're looking at a younger audience, then you might want to focus on social media or digital advertising. If you're focused on an older or more rural audience, I would invest your money in either cable or broadcast radio, things of that nature. So I think it's really targeting your audience and then choosing the media that's most likely to reach that particular audience.
And so kind of building on that, so you did focus a lot or mostly on Congressional District 2. Did you do any marketing more specific geographically than that? Like any of that, what I think is very creepy, the geo-targeting to look at how your message was playing out in different, sub parts of the state besides that big swath?
We didn't do any like on digital. We did. So our digital campaign had geo-targeting in the sense that we looked at counties where the cases were the highest, where there was the biggest concern. And we really took our lead from the department. They had, daily information about that. And so that informed our digital advertising. But we didn't do any like geo fencing of like particular buildings or anything like that. No.
Thank you. Can you talk a little bit more about how you chose your influencers? Like, how did you know who was going to be considered an influencer in your target areas and which media you had them on? So you talked about Instagram. How did you decide who and where or what they'd be on?
Well, some of that was actually decided for us. The department had reached out to a number of influencers to film videos for them, and they gave us access to those videos. And then we selected which ones we were going to use for the Instagram story ads, just based on trying to hit, again, the biggest sort of segments of those audience. So we felt like Taco Fall, who's a professional basketball player, might hit the sort of younger Southern market. Stephen King might get sort of the older, more rural. And then Patrick Dempsey is sort of spans the whole state with his influence. And so we really just picked the ones that we thought were going to have the most or sort of cover the widest variety of people.
And I will say we had some failures in that, like we made some outreach to people that we thought would be really powerful influencers with certain segments of our target audience. And they said no, for a number of reasons. They didn't want to be sort of the spokesperson for what we were asking them to do. So, you don't know until you ask, and sometimes the answer is no, and that's okay. You move on and you find people. I think we were really pleased in the end with the people who were willing to create, messages.
Yeah, there's a question about how you evaluated your work, and just even that comment you just made me think. Did you have any that were counter effective? Did any like lead people to react more? Any of your influencers lead people to react more negatively to the ads? So it's kind of a two-part question. One about evaluation, and then related to that, what did you find?
Yeah, one of them, we evaluated the campaign in a number of ways. As Sarah mentioned, some of the things we were evaluating were just impressions and sort of campaign awareness, but we were also able to get some qualitative evaluation through the social media ads that we were running. And we were able to sort of get immediate feedback of how people were reacting. Of course, that's not, statistically significant information. It's purely qualitative, but there were, when we first started running ads, we had certain ads where people were wearing masks in settings where it felt like maybe it was like a family group. And there was like people who immediately came on and said, that's ridiculous. Why would you wear a mask near someone you live with? And so we learned, okay, we have to make it clear that they're in a public setting or it's going to upset people. So we were able to get feedback really quickly when we did something that upset people.
We had one visual that was a stock image, and it was kids sledding, but it was to us clear from the background that they were sledding at like a public sort of like you know, sledding like hill. And so they had masks on, and it was this idea that, you know, still do the things that you love, but yeah, you know, and that, even though it felt like it was enough to us, there were a lot of negative comments about that. And so it was like, okay, you know, adapt. So some of it was, as Hannah mentioned, the feedback on social media is immediate, and that can be helpful.
Well, thank you. There's one more question, but we're out of time, unfortunately. So I would just say, if people do have other questions, you know, please reach out. And I do just want to thank you both very much for being here today and for your presentation. And that concludes our last session of the conference. I want to remind people to please complete the feedback form, which is right in the session. And I think then we'll just segue into our closing remarks. So thank you. I feel like this should be in all caps. I want to thank all of you so much for being here the past few days with us. Really full days, started early, ended, you know, later in the afternoon. We only gave you 20 minutes for a physical activity break, but there was a lot of like incredible and inspiring and impressive content over these 3 days. And I just really want to thank you all so much for engaging with us. I do want to also thank our conference supporters, in particular, New England Public Health Training Center for supporting this platform, and to Northern Light Health for being our keynote speaker sponsor, and then also to Maine Public Health Training Center and to Cary Medical Center for their support. Thank you to our conference exhibitors. And we were able to see in the challenge how many of you were visiting the booths for our exhibitors and our sponsors. And thank you to them for their support, and to you for your engagement and learning more about the work that they do. One more sincere thanks to our conference planning committee. A lot goes into putting together 3 full days of content covering such a wide range of different topics. And so we want to thank them for all the work they put in over the past few months, putting together this program and reviewing the abstracts and everything that went into it. And again, just one more special shout out to Heather, our membership manager, for being the staff lead and pulling all of this together, and to Event app, which is our technology support team, Frederick and Nadia, for their work doing this. I think everyone who is a speaker knows that there was a lot on the back end that went into the training. And so thank you to them for their time. So just some last reminders. If you are seeking continuing education credits, those forms are due today. If you have any questions about those, you can email us. You should be able to find everything you need right in the platform. But if you do have questions, please let us know. We're happy to help you. You should have received an alert a little bit ago with a link to our conference reminder, and you'll also be receiving an email shortly, and probably another one in another week or so, to complete a full conference evaluation. We've really appreciated those of you that have taken the time to provide us feedback in the session. We're able to share that directly with the presenter. And we also have an overall conference evaluation looking for your feedback on doing virtual versus in person, the overall theme, and really just in particular, as we look ahead to next year, what we're going to do, getting your feedback. So please take the time to give us your thoughts. This site, all the sessions are available for the next 6 months. And so you will be able to log back in here if you do want to rewatch something, or if you were unable to attend a session, you can log back in to view that. And for those of you that are seeking CHES or MCHES credits, those are available if you watch the recording. Unfortunately, the CME requirements, it does require that you watch it live. So those will no longer be available to you, but the CHES credits are. So if you are seeking those and you missed a session, as long as you watch it and complete the recording and let us know, then we can make sure that you get those credits. So now we're going to go into the winners. Thank you to everybody that joined us at the poster session yesterday. There was a lot of really great conversation in those discussions. I really enjoyed the session I was in. And special thanks to the Natural Resources Council of Maine for sponsoring 10 t-shirt giveaways. These are our winners, randomly selected. So I will be in touch with you probably tomorrow to coordinate how to get you your t-shirt. So congratulations to all of you on your win. And next we have our challenge winners. I first just want to thank everybody that participated in the challenge. There was an incredible amount of engagement. We were really impressed and excited by your high scores, visiting all of the booths, answering polls in the session, learning some trivia about both Heather and me and our families. So thank you so much just to everyone that participated. It was awesome to see that level of engagement, which can be harder, as we all know, in a virtual world to do. So in third place, we had Brittany Watt with 915 points. Second place, just 5 more points higher, but Kyle Parks came in second. And then our leaderboard winner is Carrie Louch with 945 points. There were a lot of scores in the high 800s, low 900s. So just a lot of engagement. So congratulations to you three. Thank you again to everybody. Thank you to the Bicycle Coalition of Maine and to Winter Kids for sponsoring our prize packs. And I'll be in touch with each of you about finding a way to get you your winnings, your prize. So congratulations again. And just a plug, we do still have some MPHA water bottles. These are amazing. Your ice will stay cold in here for I think even a little longer than 24 hours. They're really, really great stainless steel water bottles. So if you make a donation, you can get an engraved one and, feel free to give it as a gift to the public health hero in your life. And if you have any questions or want to do a bulk order or anything, please let me know and I can help make that happen. And the last reminder I just want to put out there is that elections impact public health. We had a session yesterday on the politicization of public health. So we've seen it and we had a chance to talk about it. So I just want to remind everybody to please vote. Election day is November 2nd, and the deadline to request an absentee ballot is October 28th. 411.org has information for you on where candidates are and the issues, what the ballot questions are. There was some discussion about ballot question 3 about the food sovereignty issue. So I think learning more about that, this can be an opportunity for you to do that. And then I just have a link here to the League of Women Voters in Maine, which also has more information. So just a reminder to vote. And here's how you can get more information about what's on the ballot. And that is it. So the conclusion of our 37th annual meeting, 2021 annual meeting. And again, sincere appreciation to all of you for being with us the past few days, to all of our presenters and supporters. And we really look forward to seeing you all next year, either in person or virtual, but we look forward to seeing you either way. So take good care.